Hello everyone, my name is Hope Randall and I'm a Digital Communications Officer for PATH's Defeat Diarrheal Disease initiative. I love the Global Handwashing Partnership and they have asked me to participate in what they are calling the Ask the GHP series, and it's essentially a knowledge sharing platform regarding different technical questions that people in the community have about hand washing with soap and hygiene and all related issues, and in my case, diarrheal disease. So the question that they assigned me today is, what does an integrated approach to diarrhea look like, and how can we advocate for this? That feels like a really big question to tackle, but I think I know a way that I can feel better and more confident. So just give me a moment. Wardrobe change. All right, this is a special Defeat DD lab coat, and it's special edition because I have my I Talk Shit sticker on it, and I have a pointer or a poo-enter, if we want to really stretch that. Now I feel better. No, not a real doctor. I know I fooled you there. But I do know a thing or two about what WHO and UNICEF have to say about diarrheal disease. So now fully confident and properly dressed, let's get started. So preventing and treating diarrhea is quite elementary, actually. I have some props to help illustrate. First, and I'm going to start with water and soap. Per the Global Handwashing Partnership, water and soap are better together. Hygiene is very important. Also, water, just clean drinking water in and of itself, also extremely important when it comes to defeating diarrheal disease. I'm also going to do another two-handed grab for a couple other important tools. These are really hard to balance. No, wrong two. There we go. I scooped the other one. Oral rehydration solution and zinc. So this is prevention and this is treatment. We will include some links underneath this video, but we are backing a petition right now for countries to adopt in their national essential medicine lists co-packaged ORS and zinc per global recommendations that children get treated with both when they get dehydrated from diarrhea. There is very low uptake of both of these medicines, but especially zinc is very low. So co-packaging them together will increase adherence, access, and decrease cost as well. All good stuff. All right, going onward to the one I accidentally grabbed before, vaccination. We have vaccines against rotavirus, which is the most severe form of lethal diarrhea in children, and especially in settings where healthcare is difficult to access. Prevention is always better than cure, and we talk a lot at Defeat DD about morbidity and repeated infections, and vaccines can help stop that cycle before it starts. Always a win. And finally, there are many nutritious foods aside from apples, and we could not capture them all here. And of course, exclusive breastfeeding for the first 6 months of life, also a very important feature. So kind of like holding all of these things together is not that easy. Integrated programs are not that easy. I won't lie to you about that. But the actual tools are pretty simple, and it's just a matter of access. So I'm going to put these down, and I'm going to tackle the second part of the question. It's a really fairly deceptively simple 4-step process here. So how can we advocate for integrated approaches? Bam. This is the way we've done it at Defeat DD, is just to talk about this issue. At Defeat DD, we let diarrhea lead the way, so to speak. It's really important to raise awareness about the problem first, and then definitely pivoting towards solutions. But we lead with the issue of diarrheal disease as an umbrella topic, because it is multifaceted and multi-sectoral. So we find that framing and raising awareness for the issue more broadly helps then people to understand why integration is important and necessary. So it's sort of the emoji umbrella, if you will, of all of these interventions. So we sound like a broken record, but it's just really important. So talk shit, and the sticker, no, it fell. I was gonna say, just like my my trusty sticker here, we have these if you would like them. They are great conversation starters, great for water bottles and laptops. That's my little PSA. So that's obvious but important. Step number 2, no pun intended, talk across sectors. Because programs, advocacy, and funding streams are in silos, it takes some creative problem solving, and it's a big scope of work for sure. And so lots of problem solving that needs to happen, and it would be pretty ironic if that problem solving happened in a vacuum. So you really need to get out of your sector silo and talk with other people. One of the practical ways we've done that at Defeat DD is by co-chairing with our friends at Global Health Council and WaterAid, a group called the Handwashing Network. So it's an ongoing conversation about ways in which we can support one another's work, and we're proud to have the Global Handwashing Partnership as a member of that coalition as well. Just as another example, the Handwashing Network has recently been raising awareness about a wash in healthcare facilities resolution that is on the docket for approval at the World Health Assembly in late May. So that's just one example of the kinds of ongoing ways we are working together. Number 3, talk to donors and governments. Are you seeing a pattern here? Because you should be. It's a lot of talking. And when I say talking to donors and governments, it's really encouraging these stakeholders to fund and implement integrated program design. In a practical level, this often looks like some degree of encouraging coordination with ministries of health, ministries of water, and ministries of finance. Every country is different, every region is different. So it's important for these conversations to happen at the country level, and for this to just be an ongoing part of our work. And it's important to say integrated policies lead to integrated programming, and that classic line of what gets measured gets done. As an example, Madagascar, the government of Madagascar actually incorporated some measurable wash targets into their national nutrition plan, for example. So that's a great way that they, to get specific here, they targeted improved drinking water access to 65% in households, and sanitation by 30% by 2020, and to promote good food and hand hygiene. And then finally, talk to us. We want to hear your ideas, and it's an ongoing conversation. We're always learning from each other, and it's no one size fits all that makes it difficult, but also exciting. I have my trusty assistant here. Gotta love the visuals. For those of you watching on mute, if you've stuck with us this far, I have a visual for you. Join the movement. And, I was remiss in not mentioning earlier, but integrated efforts aren't just for diarrheal disease. They're for typhoid, they're for cholera, which is another form of diarrheal disease. So it's really what children deserve, We always say it's about the kids at the end of the day, and they don't live their lives in these buckets of tools, and they should have access holistically to all of them. So that's what it's all about. Happy to take questions, comments, any of the above. Use the hashtag DefeatDD, and let's save and improve some lives around the world. Thank you for watching.